Computed tomography scans, commonly known as CT scans, are among the most advanced and essential imaging tools in modern medicine. These remarkable machines have transformed the way doctors diagnose and treat a wide range of health conditions. By providing a non-invasive way to look inside the human body, Connecticut scans have become a cornerstone of medical diagnostics, offering insights that were once impossible to obtain without surgery. CT scans work by using a series of X-ray beams that rotate around the body, capturing multiple images from different angles. These images are then processed by a computer to create highly detailed cross-sectional pictures, or slices, of bones, organs, blood vessels, and soft tissues. The clarity and depth of these images allow doctors to detect even the smallest abnormalities, making CT scans invaluable for early diagnosis. Physicians rely on CT scans for a variety of important reasons. They are used to quickly assess injuries after accidents, such as internal bleeding or fractures that might not be visible on regular X-rays. CT scans are also crucial for detecting tumors, monitoring the progress of diseases like cancer, and guiding surgeons during complex procedures. In addition, they help doctors plan treatments and monitor how well therapies are working. Compared to traditional X-rays, Connecticut scans offer much greater speed and detail. While a standard X-ray provides a flat, two-dimensional image, a CT scan produces a three-dimensional view, revealing structures that would otherwise be hidden. This advanced technology means that doctors can make more accurate diagnoses and develop more effective treatment plans for their patients. In emergency situations, time is critical. CT scans can be performed in just a few minutes, providing doctors with the information they need to make life-saving decisions. For trauma patients, stroke victims, or those with sudden severe symptoms, the ability to quickly visualize internal injuries or blockages can mean the difference between life and death. Since their introduction in the 1970s, Connecticut scans have revolutionized the field of medical imaging. Over the decades, advancements in technology have made CT scans faster, safer, and more precise. Today, state-of-the-art CT scanners use lower doses of radiation and produce images with incredible clarity, helping doctors diagnose conditions earlier and more accurately than ever before. The precision of CT imaging allows healthcare professionals to see inside the body in ways that were once unimaginable. With high-resolution images and even 3D reconstructions, doctors can examine organs, tissues, and blood vessels in extraordinary detail, leading to better understanding and management of complex medical conditions. This advanced imaging leads to faster, more accurate diagnoses and enables doctors to tailor treatments to each patient's unique needs. As a result, patients benefit from more effective therapies, shorter hospital stays, and improved chances of recovery. Every year, millions of CT scans are performed in hospitals and clinics across the United States and around the world. The demand for this technology continues to grow as more people benefit from its ability to detect diseases early and guide life-saving treatments. Ultimately, Connecticut scans have saved countless lives and dramatically improved patient outcomes, making them one of the most important innovations in the history of medicine. A recent study published in JAMA Internal Medicine has sparked a wave of discussion and concern within the medical community and among the general public. The study, conducted by a team of leading researchers, delves into the potential long-term health risks associated with the use of CT scans, a diagnostic tool that has become increasingly common in modern medicine. While CT scans are invaluable for diagnosing a wide range of conditions, from traumatic injuries to cancers and internal diseases, the study has raised important questions about the safety of repeated exposure to the radiation these scans emit. Doctors and patients alike are now grappling with the implications of these findings, especially as CT scans are often used as a first-line diagnostic tool in emergency rooms and clinics across the country. According to the study, the radiation from CT scans, while relatively low in a single instance, can accumulate over time, especially in patients who undergo multiple scans throughout their lives. The researchers suggest that this cumulative exposure could be responsible for a small but significant percentage of cancer cases in the population. This finding is particularly relevant for individuals who require frequent imaging, such as those with chronic illnesses or ongoing health concerns. The study's authors estimate that about 5% of all cancers diagnosed each year in the United States may be linked to previous CT scan exposure. This figure is based on a careful analysis of cancer statistics and the prevalence of CT scan usage nationwide. The researchers reviewed large datasets and applied sophisticated statistical models to arrive at this estimate, highlighting the potential public health impact of widespread CT scan use. To put this into perspective, this estimate translates to roughly 103,000 future cancer cases that could be attributed to CT scans, based on the number of scans performed in the US in 2023 alone. This number underscores the scale of the issue and has prompted calls for a closer examination of current imaging practices, as well as renewed efforts to minimize unnecessary scans. Medical professionals are now emphasizing the importance of weighing the benefits and risks of each CT scan. For many patients, the diagnostic information provided by a scan can be life-saving, but experts stress that scans should only be performed when truly necessary. Patients are encouraged to discuss alternative imaging options, such as MRI or ultrasound, with their healthcare providers, especially if they have concerns about radiation exposure. The study's findings have generated considerable attention in the media and among health professionals. However, it's crucial to interpret these results within the broader context of medical research and patient care. Not all CT scans carry the same level of risk, and the decision to use this technology should always be individualized based on a patient's specific needs and medical history. The authors of the study are careful to point out that their conclusions are based on modeling and extrapolation from other radiation studies, rather than direct evidence linking individual CT scans to specific cancer cases. They acknowledge that more research is needed to fully understand the risks, and to develop guidelines that balance the undeniable benefits of CT imaging with the need to protect patients from unnecessary harm. The study found that certain types of CT scans and certain cancer types were more strongly linked. Abdomen and pelvis CT scans were associated with the highest number of estimated cancers. This is likely because these areas contain many organs that are sensitive to radiation. The most common cancers linked to CT scans in the study were lung and colon cancer. These cancers have been linked to radiation exposure in other studies as well. It's important to note that these findings do not mean that everyone who has a CT scan will develop cancer. The authors of the JAMA Internal Medicine study are not advocating for the abandonment of CT scans. Instead, they want to make it clear that CT scans remain a vital tool in modern medicine, often playing a crucial role in diagnosing a wide range of conditions, from traumatic injuries to cancers and internal diseases. These scans have saved countless lives by providing doctors with detailed images that can reveal problems invisible to other forms of testing. The message is not to avoid CT scans altogether, but to use them thoughtfully and responsibly. They acknowledge the life-saving benefits of this technology. For many patients, a CT scan can mean the difference between early detection and missed diagnosis, leading to better outcomes and more effective treatments. The technology has revolutionized the way doctors approach complex medical cases, allowing for faster, more accurate decisions. However, with these benefits comes a responsibility to weigh the risks and benefits for each individual patient. However, they urge doctors to use CT scans judiciously and to minimize radiation exposure whenever possible. This means carefully considering whether a CT scan is truly necessary for each patient, and exploring other diagnostic options that may carry less risk. Doctors are encouraged to have open conversations with their patients about the reasons for ordering a scan, the potential risks involved, and any possible alternatives. They recommend using CT scans only when there is a clear medical need and no suitable alternative. This approach helps ensure that patients are not exposed to unnecessary radiation, which can accumulate over time and increase the risk of long-term health effects. By reserving CT scans for situations where they are truly needed, healthcare providers can protect patients while still delivering high-quality care. The study authors also emphasize the importance of optimizing CT scan doses. This means using the lowest possible amount of radiation that still provides clear, useful images for diagnosis. Hospitals and imaging centers are encouraged to regularly review and update their scanning protocols, making adjustments as technology improves and new research becomes available. They note that there is a wide variation in radiation doses used for the same type of scan, depending on the equipment, the settings, and the patient's size and age. This variation highlights the need for standardized guidelines and ongoing training for medical staff. By tailoring the scan to each patient and using advanced technology, it is possible to significantly reduce unnecessary exposure. Lower doses can often provide sufficient image quality while reducing the risk of radiation-induced harm. The goal is to strike a balance between obtaining the information needed for accurate diagnosis and protecting patients from avoidable risks. As technology continues to advance, both doctors and patients should stay informed about the safest and most effective ways to use CT scans, ensuring that this powerful tool continues to benefit health without causing unnecessary harm. Many medical experts have weighed in on the findings of the JAMA internal medicine study. They agree that CT scans should be used carefully and that radiation doses should be minimized. However, they also emphasize that the actual risk to an individual from a single CT scan is very small. Experts point out that the benefits of getting a CT scan often outweigh the small increased risk of cancer. For example, a CT scan can help diagnose a life-threatening condition like a pulmonary embolism or a ruptured appendix. In these cases, the potential benefits of the scan far outweigh the risks. It's important to acknowledge that, there is still a lot of uncertainty surrounding the estimates of cancer risk from CT scans. The JAMA internal medicine study is based on modeling and extrapolation, not on direct observation of cancer cases. More research is definitely needed to confirm these findings and to refine our understanding of the risks. Scientists are working to develop more accurate methods for assessing the long-term effects of radiation exposure. This research will help doctors and patients make more informed decisions about the use of CT scans and other medical imaging procedures. To put the cancer risk from CT scans into perspective, it's helpful to compare it to other common risks. The study authors note that the increased cancer risk from CT scans is similar in magnitude to the increased risk from factors like alcohol consumption and obesity. Now, this does not mean that CT scans are as dangerous as drinking heavily or being severely overweight. It simply means that the relative increase in risk from these different factors is roughly comparable. It's important to remember that many factors contribute to an individual's overall cancer risk. When it comes to medical imaging, open communication between doctors and patients is, honestly, essential. Doctors should clearly explain the reasons for ordering a CT scan, the potential benefits, and the potential risks. Patients should feel comfortable asking questions and expressing any concerns they may have. In some cases, alternative imaging tests such as ultrasound or MRI may be appropriate. These tests do not use ionizing radiation, and therefore do not carry the same cancer risk as CT scans. However, they may not be suitable for all situations. CT scans are powerful tools that have, really, revolutionized medical care. They allow doctors to diagnose and treat a wide range of conditions quickly and effectively. However, like all medical procedures, Connecticut scans come with potential risks as well as benefits. It's important for patients to be aware of the potential long-term risks of radiation exposure, even if these risks are small. By working together, doctors and patients can make informed decisions about the use of CT scans and other medical imaging procedures, ensuring that the benefits outweigh the risks.